Welcome to Opioid Overdose Response Training. Thank you for carrying naloxone and maybe saving a life. In this video, we'll talk about how to prevent an opioid overdose, what to do if you see an overdose, and how to use naloxone to prevent overdose death. Opioid overdoses happen when too much drug makes it hard for a person to wake up and to breathe. Opioids include prescription medications like hydrocodone, Percocet, morphine, methadone, or others, and street drugs like heroin and fentanyl. Street drugs could be mixed with powerful opioids, even if they look like prescription medicine or aren't sold as opioids. If you see someone who has signs of an opioid overdose, treat it like one, even if you don't know what they took. We'll now review some opioid-related safety tips. If you use opioids, try not to use alone. Follow the directions on a prescription. Don't take opioids with alcohol or other drugs. Buy from the same source. If you buy from a different source, use a small test dose. Be extra careful if you haven't used opioids in a few days, since you will not be able to handle the same dose you used before. Make an overdose plan with friends or family. If you are close to someone who uses opioids, keep naloxone on hand and know where it is. Talk about overdose and how to use opioids as safely as possible. Be extra alert for overdose if your loved one returns to use after a break of a few days, is experiencing new stress or other mental health issues, or is sick, dehydrated, or in poor health. Now, let's talk about what an overdose looks like. The person may be breathing very slowly or not at all. They probably won't respond even if you shake them and yell their name. To check if they can respond, rub your knuckles hard along the bone in the middle of their chest. This is called a sternal rub. Other signs of an opioid overdose include small pupils, blue or gray lips and nails, pale and clammy skin, and choking, snoring, or gurgling sounds. If you see someone with signs of an opioid overdose, act quickly, but don't panic. First, call 911. The 911 operator can tell you what to do and send an ambulance. Lay the person on their back and give naloxone. We'll show you how to do this later. After you give naloxone, start rescue breathing or CPR if you know how. You'll get a brochure today that reviews rescue breathing. If you can't do rescue breathing or CPR, or if the person starts breathing on their own, lay them on their side to prevent choking. After giving naloxone, wait 2 to 3 minutes. This may seem like a long time to wait, but it's important to give the naloxone time to work. If the person is still not breathing after about 3 minutes, give a second dose of naloxone. Keep giving naloxone every 2 to 3 minutes until the person is breathing, you run out of naloxone, or the ambulance gets there. Stop giving naloxone when the person is breathing normally, even if they are not fully awake. Stay with the person until the ambulance gets there. If they do wake up, they may feel sick, angry, or confused. Stay calm and tell them what happened. Tell them not to take more opioids. Now, let's talk about naloxone. Naloxone blocks the effects of opioids and helps a person start breathing. If they didn't use opioids, naloxone won't do anything, so it is safe to give even if you don't know what someone took. Naloxone is either sprayed in the nose or injected into a muscle or vein. The amount of naloxone needed to reverse an overdose depends on what drug someone took and how much. A successful rescue may require as little as 4 milligrams of naloxone in the nose or less than 1 milligram of naloxone injected in a muscle. But every overdose is different. Sometimes a lot of naloxone may be needed for a person to start breathing again. It is estimated that rescuers use higher doses of naloxone in about 1/3 of overdoses. Some opioids also stay in the body longer than naloxone does. This means that a person rescued with naloxone may slip back into an overdose when the naloxone wears off. When a person uses opioids regularly, naloxone can cause them to go into withdrawal, which can include body aches, diarrhea, nausea or vomiting, fast heart rate, fever, runny nose, sneezing, sweating, restlessness, or irritability. The amount of naloxone that causes withdrawal depends on the person and the opioids in their body. Withdrawal is more likely and may be worse when higher doses of naloxone are given. We'll now review how to give naloxone. You'll see 3 naloxone products, and after this video, you'll choose one product to take home today. So think about which naloxone device and dose you want to carry. Naloxone injectors let people without special medical training give naloxone in a muscle. To use an injector, take the cap off the needle and stick the needle into the outer thigh. The needle can go through clothing if needed. Then, push the plunger until it clicks. Hold for 2 seconds before taking the device out and pulling the safety guard over the needle. Put the device back in the case and get rid of the case using a sharps container. Injectors can only be used one time, so do not try to reuse the device after you've pushed the plunger. Zimhigh is a 5 mg naloxone injector that came out in 2022. It comes in a box of 2, so you can repeat the 5 mg dose of naloxone if needed. Naloxone in the nose will work even if the person is not breathing. It comes as a one-time spray that is ready to give as soon as you take it out of the package. Peel open the package and remove the spray. Place your fingers on both sides of the nozzle. Put the nozzle in one side of their nose until your fingers touch the bottom of the nose. Firmly press the plunger to spray the whole dose into their nose. Take the nozzle out of their nose and throw the device away. Once the plunger is pushed, the dose is gone, so do not test the device before you put it in the nose. Don't try to reuse the device after you've pushed the plunger. There are 2 names for this kind of naloxone. Cloxato is an 8 mg spray that came out in 2021. It comes in a box of 2, so you can repeat the 8 mg dose of naloxone if needed. Narcan nasal spray is a 4 mg spray that came out in 2015. It comes in a box of 2, so you can repeat the 4 mg dose of naloxone if needed. This concludes our opioid overdose response training. Thank you for watching and for joining this important effort to save lives. Please return the iPad to the study staff to complete a survey and pick up your naloxone product to take home.